Hello guys, welcome to PW MedEd YouTube channel. Myself Dr. Ranjith, your pathology faculty at PW MedEd, and I'm going to discuss something which has been asked multiple times in the past few weeks for students who are aspiring for FMGE June 2023. So for the next 6 to 7 minutes, I'm going to strategize something. We're going to give you a super beautiful offering for everyone who's sitting for the upcoming FMGE June 2023 exam, right? The first thing is, what is about FMGE June 2023 and how to approach the subjects for the June exam. The best way to decide any approach is to look at the immediate past. If you look at the December exam, we had lots of learning experience from the December exam, and we hope that learning experience should be implemented for the June exam in order to ace that. The first thing, if you look at the December paper, the part A, the pre-paraclinical, was a little bit of easy to moderate level. If you look at the part B, I won't say it's difficult, I won't say it's undoable, but it is more of clinical based scenario. It is more of case scenarios, it is more of integration, it is more of diagnosis and understanding it. So the way going forward is, there should be no rote learning. Don't memorize stuff, understand. The concepts are going to help you a long way, not just for FMGE exam, for next, NEET, whatever it is, INICET, whatever it is. The conceptual understanding of a subject and the integration and application in a real-time diagnosis and the way to treat is what is exactly asked in your exam. So the best thing what you can get from the December exam is learn conceptually, do not memorize. Learn in depth, not superficial. Learn to treat, not to know the science, right? So we will definitely be there to help you to understand the basic core concepts of all the 19 subjects. That's what PW MedEd is here for, right? The next thing is, what can I do and what are the problems which are faced in the last 2-3 months of the students who are sitting for the exams, right? If you look at the students sitting for the FMGE June 2023 or any June exam, they must have already given the exam by December. Unfortunately, they didn't score well, so they're going to give the exam again. So which means I have a beautiful advantage, which means you guys have already studied for the December exam. You guys already know the theory, you guys already know the basics. So what I'm going to do here is, I want you guys to revisit what you did in the last 6 months. Take the good points. You must have definitely done something good. Focus on that, repeat that. I'm sure you must have definitely done something bad also. Focus on that, do not repeat that. That's more important for me. Like for an example, let's say that for the 6-8 months you saw n number of videos, you saw n number of notes, you wrote everything, but you didn't prepare MCQs, you didn't solve MCQs. That's a problem. If that's the problem, here in the next 2 to 3 months, I want you to focus on little bit more MCQs. Please do not overdo. Don't say that last 6 months I did theory, this 2 months I'm going to do only MCQs. That also is going to be bad. I need a balance of both, right? So you need a conceptual understanding of the subject. You need to solve the questions. You have to look at the questions and look at the mistakes and improvise on them, right? So in the next 2 to 3 months, I want you guys to just sit for a day or two, revisit your last 6 months and take points what to do, what not to do. We'll guide you on what to do and what not to do, but the best judge is you, because you guys know what mistake you did, you guys know what good things you did, right? Next. So what PW MedEd can offer you? We are going to launch something called an FMGE Accelerator batch. It's FMGE Accelerate. It's Accelerate, right? You have already a base. We're just going to make sure with the push, you'll get 150 and beyond. So this FMGE Accelerate batch will have live classes. We'll have the class notes also. Will be there on the YouTube as well as the PW MedEd app. If you want a clutter-free environment, you just download the app. The link will be there in the description. Just learn it without any other disturbance. You'll have only the classes and the class notes. It will be all the 19 subjects. Every subject will be handled in 2 days so that you need not worry about anything. For the next 38 days, we'll have 2 days. For every subject, I'll make sure we'll help you understand the basics ideology, help you to apply that in MCQ, help you to solve that. Not just that. To assess, to test yourself, you will definitely have 2 grand tests before your FMGE exam. So that you can make sure you learn, you apply, you practice, you analyze, you excel. And the best thing about this is, I'm sure you guys must have spent a fortune in the previous exam itself. So it'll be difficult to put a hole in the pocket again. It'll be difficult to ask the parents again. I've been a student once, so I know the difficulties. So this FMGE Accelerate is going to be free of cost. I would wish you guys to download the app so that you can learn in a clutter-free environment, no other diversion at all. Download the app, enroll to the batch, it will be free of cost. The notes of the lectures will also be there in the app. You can download them, you can see them. The GTs also will be the app, you can solve them as well. So the entire thing is going to be free of cost. And we are here with a mission to make education affordable and sure to make education fun, interactive, conceptual learning as well, right? At any point, we're not going to let down the quality. We'll make sure you guys are going to learn the concepts from all 19 of us. As a team, you, me and everyone else is going to excel the FMGE exam in June and next or INICET as well, right? So this is about FMGE Accelerate, and our main goal and your goal, my goal and everyone's goal here is to look at FMGE at 150 and beyond. I want the beyond, not just the 150, right? If you have any doubts regarding the FMGE Accelerate, please put down in the comment box. I'll be more than happy to address any of your queries. We are improvising and we'll make sure this PW MedEd will be better than the best. Right? Thank you for your patient listening and all the very best from the entire PW MedEd team for all the aspirants appearing for the FMGE exam. Thank you. See you soon. Till then, bye-bye from Dr. Ranjith. Bye-bye.